What's going on, everyone? Happy Friday to everyone. Welcome to the Friday edition of the Pandemic Update for Friday, June 2nd, 2023. Hopefully, everyone's staying safe, healthy. If you had to take a COVID test, hopefully you've turned up negative. However, I do know a lot of people are testing positive right now, and we are actually starting to see COVID positive cases pop up in celebrities. We reported on the Singapore Prime Minister yesterday. There's actually two more positives today. One which I archived, one which I haven't gotten to yet. And the one that I did archive is U.S. Representative Deborah Ross. She actually tested positive back on Tuesday, May 30th, and currently she is 59 years old, and this did prevent her from showing up at the debt ceiling vote because she's positive with COVID. Moving on, we do have something else to talk about on the website. We'll get to that in a moment. First off, let's get to India's COVID-19 cases, and their caseloads continue to drop. 267 cases, and they added another 2 deaths. The caseload is now at 3,736. Moving on to this, we're just going to read a headline here. The lockdown effect. Number of children now regularly missing class post-COVID surges by 12% to 1.6 million after the pandemic normalcy truancy. This is in the UK, and it's ridiculous that they're blaming truancy. Maybe some of it can be, but we do know not everyone recovers in a timely manner from COVID. And some people do end up getting long COVID, and we know that can impact their day-to-day routine. It can impact them trying to do their day-to-day activities, and it can prevent them from doing so. There's a lot of people going through with that, and it does happen in kids. So yes, it's just another effect of this god-awful pandemic. Now moving on to something that you're going to see on my website, and this is a story from the Washington Post. As monkeypox worries return ahead of Pride, a leather convention offers hope. Forget that. What we want to see here is this. Chicago has recorded 31 infections of monkeypox in the last 5 weeks. And if we come over here, go back to my website, to the monkeypox section of the site, you can see here, I actually updated the thread today. Before, it was at 29 cases in our previous update. The new update, because of the Washington Post, what we saw there, it now says 31 cases of monkeypox in Chicago. So Chicago is continuing to see an increase. This is not good. I think their updates seem to be weekly right now. We'll have to see if they add any more cases next week. Moving on to this. High concentrations of COVID detected at all 14 New York City wastewater treatment plants. This is not good. We're going to actually take a little tour of New York State later on in the video. We're going to take a look at some places that we don't normally do, because we want to see what's going on in the rest of the state. Moving on to the next portion of the video here, which is this. Canadian researchers find brain inflammation in patients with long COVID. So this is not good. We're just reading this headline. And this one, we're going to read a headline as well. Symptoms linger 2 years after COVID-19 for 1 in 6 unvaccinated people. So that's not good, and it's more of a reason to get vaccinated. Yes, I know, symptoms can linger in the vaccinated as well, but it's showing what happens to the unvaccinated. Moving on to this. This is also not good. 96% of U.S. blood donors had SARS-CoV-2 antibodies in 2022. CDC reports during July to September 2022. 96.4% had antibodies, including 26.1% from vaccination alone, 22.6% from infection alone, and 47.7% from both. So it's turning out a lot of people actually had COVID, and I am willing to bet many of these people didn't even realize they had it. Maybe they thought they had something else. Maybe they were asymptomatic and just did not test. And turns out, surprise, they had a COVID infection. Alrighty, this is from Dr. Eric Ding, and this is a mini thread that he put out there. I retweeted this already. Over 70% of households COVID-19 spread started with a child, says new study of 850,000 U.S. households. Interesting. Because remember at the beginning of the pandemic, they said, oh, kids don't really spread it or get it bad. But yet at the same time, they said, oh, no, your child should not go see its grandparents. Ooh, no, that could be dangerous. It could give them COVID. But here we are. It says younger kids under 8 and more likely source of transmission more than kids 9 through 17. In-person schools also resulted in substantial spread. And he says just the facts. And yeah, that's all it is. It's facts. 70% of households out of 850,000. Haha. What's that telling us? Yes, it actually was being spread. That was causing spread. All right, I asked this question last night, and a couple people said, can you include long COVID? I said, sure, fine. Do you currently know someone or yourself who is positive with COVID right now? And 34.8% of the people said yes. 65.2% said no. Now, no won this, but 1,164 votes. So out of that, 34.8%, that's quite a few people. Now, if I would have made this a little easier and maybe said RSV, flu, influenza, like all the other stuff, I bet that yes number would have been a heck of a lot higher. Because if you saw my previous update on Hubbub World and their data from their model, you know that influenza-like illness is really spreading in a lot of areas. The Walgreens COVID positivity index for today is 22.4%. We have nothing in COVID pandemic history today, at least nothing that we can report on, because just can't. But moving on to this, and the wastewater in all regions continues to drop, despite what's going on up in New York State right now. And incidentally, look at this. This is not good. Despite that being so good, this is not good. 80 to 100% transmission in a wastewater site. There's now 9 of them, and the orange category, which is 60 to 79%, there's now 25% of them. We will have our full wastewater update on Sunday, and like I said, the headline reads, all 14 New York City sites are now rising, and that does confirm that the Hubbub World and their data, it's correct. It projected that there would be extremely high transmission there, and it's continuing to project that going into next week. So this is alarming and something we're going to have to continue watching. XBB.1.5 is 53.8% of the cases. XBB.1.16 is 15.1% of the cases. And let's skip down to XBB.2.3, which is 4.9% of the cases. If you're wondering, well, wait, doesn't this usually update on Fridays? No, it's every other Friday now. So next Friday, we will get the update on this. All right, New Jersey, not good. 69 out of 70 hospitals are reporting. So one did not report today, but 206 people are hospitalized. 23 people are in the ICU, so that's not good. 10 people are on a ventilator as well. That's also not good. Alrighty, Pennsylvania, the dashboard doesn't update anymore. Maybe it'll be every other week, maybe it'll be monthly. Doubtful, though. And speaking of Pennsylvania, there's a few things we want to look at here. Daily totals for Philadelphia yesterday. It was an extremely busy day. 798 EMS calls, and if I had to guess, Philly is probably high today. It's a heat day. It's really hot here. It's currently 92 degrees outside on my weather station. And anytime we get a heat day, we get a lot of respiratory calls. The suburbs have been busy all day long. Taking a look at Montgomery County right now, there's 17 active incidents. At one point, that was well into the 20s. And at one point, we did see 7 or 8 cardiac-related calls at once with cardiac arrest. I see we have stroke on here. We also have dehydration. We have nausea, vomiting, respiratory emergency, several syncopal episodes. So yeah, it's a very busy day in Montgomery County, as it has been a busy day in Chester County, Pennsylvania, as well. Alright, moving on to New York State. 546 cases in the last 24 hours, not including reinfections, and not including those at-home tests. 4.9% positivity in the last 24 hours. 4.2% is the 7-day average. So positivity continues to be elevated. It hasn't risen anymore, but it's still elevated. And let's take a look at New York State hospitalizations. I am going to refresh this because I was playing around with this here just before the video, taking a look at some other regions. And as you can see here, on the statewide level, 560 people are hospitalized, 63 people are in the ICU. And we also want to take a look at hospital admissions. You can see they're relatively holding flat. They did start off slightly higher on I believe this was the Wednesday update. That's because there was a holiday weekend. All right, let's take a look at New York City. New York City hospital admissions, for the most part, are flat. When we take a look at current hospitalizations, they did rise. 199 people versus yesterday's number of 186. So that's up by 13. And ICUs is up by 1 to 26. We want to take a look at a couple regions here. Long Island. Now you're looking at Long Island here, you're saying, hospitalizations aren't rising all that much. True. You can see here, they're not rising that much. But when I flip this over to hospital admissions, haha, look at that. There's quite the increase in hospital admissions starting to happen. So we suspect hospitalizations themselves in Long Island are going to start rising again soon. When we come over here to the capital region, look at this. There's starting to be an increase in hospital admissions. And let's take a look at hospitalizations. Yes, they're rising as well. In fact, last week the lowest number was 22. This week the highest number is 39. So that's a difference of 17. So yeah, they're starting to rise up in the capital region, and curiosity's got the better of me. What's going on in Western New York? It's holding flat right now. Let's take a look at admissions in Western New York. And they've actually dropped a little bit as well. I mean, you had that little surge because of the holiday weekend and there being a lack of reporting, but after that, nope, they're actually dropping right now. All right, let's take a look at Texas. Texas, 3,675 new cases this week. Just 36 fatalities, which is one less than last week, and 643 people hospitalized. That's actually down by 85, so that's not a bad thing. Taking a look at the latest international cases, we'll just do a few of these because we want to get to this week's flu update. Worldwide numbers are down by 22% for cases. Deaths are down 46%, and you know what? I say we keep seeing this number shrink, but it has never gone to the positive level. So it continues to drop, and I think that's due to the lack of testing. Now, some of the places where we're seeing big rises, some of them are gone now. There's still a few of them, though. France, cases are up 26%, deaths are down 33%. Singapore, cases are down 28%, no deaths were reported. Mexico, cases down 16%, deaths are down 9%. Then we come down here to Colombia. Cases are up 62% in Colombia, and deaths are up 143%. Afghanistan, cases are down 28%, and 2 deaths versus 1 death. And then we come down here to Norway. Norway's seen a 4% increase in cases, no reported deaths. Poland, 26% decrease in cases, 9 deaths versus 11 deaths, which equals an 18% decrease. Alrighty, let's take a look at this week's flu update. There are multiple categories here: minimal, low, moderate, high, and very high. Luckily, nowhere is in the very high category, but we do have Washington, D.C. and Puerto Rico, which are still in high levels of flu. New York City has now dropped to moderate levels of flu. Then you have New Mexico, which is at low levels of flu, as is California. So New Mexico and California are at a level 2 out of 5 on this scale here. And the rest of the country, for the most part, is in minimal, with some places being close to low, such as Texas. Alrighty, that does it for today's pandemic update. We will have another pandemic update again tomorrow. We're also going to have our monthly staffing shortages update. The jobs numbers came in today, and guess what? We can report to you where there are still staffing shortages, because there's quite a few of them. There always are. And if you want to see the latest information that I put out, the best way to do that is to follow me on Twitter at COVID Data Report. You can also go to my website if you want to see any past information. If you need to look someone, hey, did someone have COVID? Or do you want to look up a study? My website's a great place to do that, datareport.info. We also have another YouTube channel where we discuss the weather, and that is at Climate Data Report. Alrighty, thanks for watching this video. If you liked this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. I will see you all again next time over the weekend. I'll be here tomorrow, and I'll be doing videos on Sunday as well. Until I see you again next time, stay safe, everyone. Thanks for watching, and have a great weekend.